Hello and welcome back to Communicable, the podcast brought to you by CMI Comms, ESCMID's open access journal covering infectious diseases and clinical microbiology. My name is Angela Huttner. I'm an infectious disease doctor at the Geneva University Hospital in Switzerland and editor-in-chief of CMI Comms. I'm joined again by my co-host, Marc Bonten, fellow editor at CMI Communications, professor of molecular epidemiology of infectious diseases in Utrecht, the Netherlands, and CEO of E13.
Hello, happy to be here again.
Today, the topic is the Wild West of publishing in infectious diseases and clinical microbiology, and maybe medicine in general. We're delighted to have two guests with us. The first is Dr. Ursula Hofer, editor-in-chief of the Lancet Infect Dis since 2022. Before this, she worked for almost 10 years at Springer Nature, including as chief editor of Nature Reviews Microbiology. She is a fellow Suissesse. She comes from Switzerland. She received her medical degree from the University of Bern and her PhD in infection biology from the University of Zurich. Before becoming an editor, she practiced internal medicine and clinical immunology in several Swiss hospitals and worked as a postdoctoral fellow at the University of Southern California.
Hello. Thanks so much for having me. It's my pleasure to see you all.
And our second guest is Professor Leonard Leibovici, editor-in-chief of Clinical Microbiology and Infection, ESCMID's original official journal since 2016. He served as the senior editor of the Journal of Clinical Microbiology for 10 years, as an editor with the Cochrane Acute Respiratory Infections for 3 years, and as a member of the British Medical Journal editorial board for 5 years. He is the chairperson of the research authority Rabin Medical Center Petach Tikva in Israel, and he's a full professor in the Faculty of Medicine at Tel Aviv University and a doctor honoris causa at Aalborg University in Denmark.
Thank you. Thank you for the invitation.
Now, our listeners know already that we start these episodes with a get-to-know-you question for our guests and also for our hosts. And you're both editors, so I have to ask you, what book do you think everyone should read? I will start with my recommendation, which is currently the book I'm now reading and using for teaching. I was asked to give a lecture to students on misinformation and vaccines, and I think the ultimate book to start with is, of course, The Doctor Who Fooled the World. And that's a book on Andrew Wakefield, who published in 1998 on a new disease that he linked to measles vaccination or MMR vaccination, which had a profound impact on vaccination rates across the globe, but especially in the United Kingdom. Brian Deere was the one who investigated all this, and I think it was all edited by the British Medical Journal, which led to the retraction of the paper from Lancet, but harm had already been caused, and I think it's a very clear example of fraud and misinformation and how that impacts healthcare. So that was my recommendation. What about you, Angela?
Thank you, Marc. My book has nothing to do with medicine and certainly not with infectious diseases. The one I kept coming back to, even though it sounds totally pretentious, is War and Peace, because it really is an amazing book. I think I've read it twice, although as my mother once said, you know, you're allowed to skip some of the war parts because they're really long and redundant. And the really good stuff is, of course, in the peace parts. I do wish everyone would read because it's, I think, the first anti-war novel. And I think in these times, it really should be required reading. Okay, so moving on, maybe back to science and medicine. Leonard, how about you?
Yeah, actually 2 books, both of them because they are excellent and fun to read and are really relevant to our discussion today. The first one, Dead Souls by Nikolai Gogol, and the second one is Felix Krull by Thomas Mann. So if Chichikov, Gogol's protagonist, was living today, I'm sure he would have started hundreds of predatory journals and congresses and rubbed elbows with people in academia. It's much easier than buying Dead Souls. So 2 outstanding books about interesting scoundrels.
Good. And Ursula?
Yes, my choice is Plastic Fantastic, How the Biggest Fraud in Physics Shook the Scientific World. I was inspired by the topic we have today. So it's a really interesting book. It's not medicine at all, but it is about a physics researcher who committed fraud over years. He was working on semiconductors and he published in Science, Nature, so on. And he went to conferences, was really highly lauded. And all of it was made up. And it only came out after years and years of research. And somehow the whole environment that enabled this fraud, I find it really interesting. The universities he worked at, the groups he was in, his mentors, the editors on journals as well. It's a really interesting book. Unfortunately, it's out of print, so you would need to get a second-hand copy, or otherwise you can contact the author. She's called Eugenie Reich, and she still has some copies that she's happy to send people.
Great. Thank you so much. It's incredible how much fraud is in the news. So I guess it's very timely that we're doing this episode. So we've entitled this episode Publishing in the Wild West, but we think maybe that's not very kind to the West. Predatory publishing is defined as an exploitative academic publishing business model where the journal or publisher prioritizes self-interest at the expense of scholarship. It is characterized by misleading information, it deviates from standard peer review process, and it's highly non-transparent and often utilizes aggressive solicitation practices. So that's the official definition of predatory publishing. That's what we know is happening all around us. We know the current situation is bad. But Ursula, can you put some numbers on it? How many predatory journals are out there right now in 2024? What are the financial dimensions of this industry? How big has it gotten?
Yes, first to start off, it's very hard to put numbers on this. And then I'm not a finance person. I'm not a publisher. I'm interested in the scientific side of things. And obviously I am interested in the ethics and how the system works. But the numbers I have found have to be taken with a grain of salt. It's very hard to find this information. I searched it up, and then there are only estimates out there because obviously the predatory publishers don't go and then file a tax return where they tick a box. I am a predatory publisher and I'm earning $2 million a year or something. So people have done analysis where they look at journals that are suspected to be predatory, looked how much they publish, how many articles they have, and what they charge, and then they come up with some kind of estimates, and they vary wildly. So between $70 million to $10 billion, who knows? In a way, 10 billion seems quite high to me. So I'm not sure whether this is accurate, because if you look at the proper academic publishing market, that's around, I think, 18 or 19 billion a year. So if half of this was predatory, I would be quite surprised. But I don't know, maybe if you take other things into account, like conferences, stuff like this, then maybe. For the number of journals, again, it's the same. There are different kind of blacklists out there that list journals that are suspected of being predatory. And there, again, it's a couple hundreds to maybe 8,000, something like this. And then lots of estimates are somewhere in the middle there, maybe around 2,500 journals that are suspected. But then not all of them still are active, keep publishing. And then besides that, there's a bit of a gray zone, I would say. They're the clearly predatory publishers. Some of them even have been convicted legally to pay fines because of their behavior. Then on the other side, there are traditional publishers that are supposed to be ethical, but some of the journals associated with traditional publishers, they still do naughty things, I would say, like lots of the special issues with guest editors where there is no proper oversight. Then some of them, it's not even their own fault. So if you get invaded by paper mills where papers are made up, or those citation cartels, peer review rings, all kind of unethical behavior. And if you're not very careful with oversight, then some traditional journals that are proper journals can have trouble too. So it's a bit of a sliding scale in a way.
You mentioned paper mills. Can you tell us more, for those who are young doctors or young microbiologists who are just starting out in the publishing world, what is a paper mill?
So paper mills, you pay them a fee and they give you authorship. So they can write papers for you, or they can give you co-authorship. They submit for you. They try to find journals for you. Sometimes they publish in proper journals. Sometimes they have their own publishing business where they have actually predatory journals as well. They put the articles in there. So on a large scale, really organized. I don't know whether you can call it crime. It depends on the legal setup for where this is happening. So you get your publication that you can put on your CV, that you can submit to where you have your grant form to your university, and then you've got a tick box, but is this paper proper scientific work? No. This really happens on a big organized scale. So it's a real business. there are people out there running paper mills that make a lot of money like this.
Leonard, going back from the finances to the origins, can you give us some historical context on this? When did this all start and how did it get out of control?
Yeah, we should start with the open access model. The open access model where the copyright is with the author and not with the publisher. The content is open to all to read from the beginning. And someone is paying for that, of course. It was started to be discussed in medicine in the 90s. But looking at the history, there are two events I would like to know when they've happened. The first one is, when was that? When the big publishers made their calculations on how much they would ask for publishing an open access article so their profit won't be affected. I'm talking mainly about the for-profit publishers, but also the societies, those societies that are supported mainly by the income from their publications. You probably know that the profit margin and the income of the big publishers are a well-guarded secret. So again, talking about history, how were the fees for open access articles decided? And the second point in history or in time is the moment when a decision was made by a person or by a group of people to start a predatory journal. There are a few publications on that. So one analysis pointed at 3 journals as the candidates for the first predatory journal. They were published, all 3 of them, by a publisher named Ansinet in 2001. So probably we have a date for beginning of predatory journals. They were the Journal of Applied Sciences, the Journal of Biological Sciences, and the Journal of Medical Sciences. And looking at Ansinet website now, they have 51 journals, all active. Active meaning that you can submit an article to each of them, but only 18 out of the 51 journals had published issues in 2024. Quite impressive, going from 3 articles in 2001 to 51 today. 18 have had published issues in 2024, and the rest had their latest issue going back years. One of them, the latest issue, was in 2014, but you can still submit articles to this journal. The decision to start a predatory journal is very interesting because these people realized that money can be made, that big journal were and are asking for thousands of euros to publish an open access article. So they, the new journals, can be more attractive by asking for less. And they realize that the expenditures are minimal. A website, especially if you abandon the need for peer review, for safe archiving, and for a paper issue. And they realize that people need to feed this monster of counting papers for academic appointments. I think it was quite a stroke of genius. Maybe we should have done it in 2001. Okay, that's about history. Next time we'll have a podcast on this topic. Maybe we should invite people who first thought of founding such journals, because it would be interesting to hear from them, to ask them, how was it at the beginning?
Okay, Leonard, I'm really glad you didn't, though. I'm glad you made the choice not to go there. One more question for you on that, Leonard. So you mentioned this, predatory publishing centers around academic medicine. So do you think that universities have a role, whether they mean to or not? Are they also driving this industry? And if you think so, how are they doing it?
I'm quite sure that predatory journals are a symptom, and they are a symptom of bad things that are happening in the academia and in the publishing world. And of course, we should address the symptom. When the patient has a high fever, a very high fever, we try to get it down. But we also should think about the reasons or the causes behind the symptom. And the 3 such causes. The first one is when assessing candidates for promotion, many universities are just counting publications and will say, no, we don't do that. No way we are counting publications, but they do that. They count publication. This drives people to have as many publications as possible, never mind the quality or impact, and it overflows into the predatory journals. That's one thing. The second thing is that there are too many journals and too many publications out there. The number of publications could be cut by, 50%, 80%, and no harm would have been done. There are a lot of publications out there that do not add anything. And there are some publications that are very important, but the data could have been put in some organized database and not published as a publication or counted as an academic publication. The third point is that publishers are charging thousands of euros for an open access article. Predatory journals can charge hundreds of dollars and offer publication and never mind peer review, etc. And they are attractive because of that. So predatory journals are the symptoms of the drive of the universities and other institutions to count publications, to the too many journals and too many publications that have really no added value, and to the money that can be made quite easily by publishing. I had a discussion with Angela over email, and she was asking, can we really think about a solution? The truth is, solutions are not that difficult. For appointments at the university, one solution: look at the best 5 or 10 studies done by the researcher. Never mind the number of publications. Just look at the 10 best studies done by this researcher. Stop publishing articles that mean almost nothing or that have important data but should have been best shown in well-organized databases. For example, susceptibility patterns all over the world, or in countries or in towns or in hospitals. And stop charging for open access publications sums that are inflated by probably quite a huge margin of profit to the publisher. Find a modest model, one that will not need such high payment, one that will allow all research results to be available to all at a modest price. And there are such models being discussed. If you're looking for them, it's quite easy to find them. They're not implemented. In these models, we need to favor researchers that have no money, but are still doing good research. And these are not only researchers in poor countries, but also researchers at the beginning of their way, doing research on their own time with no support. So solutions are maybe not so difficult to find. We need conviction to implement them. We need to convince people and organizations that have so much invested interest, that are earning money or prestige, to adopt these solutions.
Yeah, thank you, Leonard. That's quite a clear description of a sick patient, as you started with. And I'm glad that I'm at Utrecht University, where our dean started a movement about 10 years ago called Science in Transition, trying to change all this. I will go now to Ursula to ask her what researchers are at highest risk of becoming a victim of predatory journals of predation.
Yes, so Leonard already mentioned early career researchers. Quite often it depends on where you live and the university you're at. You do need publications to get your degrees, so there's also counting going on there. We all know how it goes early on in research. Stuff doesn't work and you still have to publish to get your degrees, so that puts pressure onto people. Besides that, you're probably also not very familiar with the publishing environment, the journals that are there, and then if there's little support from your supervisor, then you Google journals and you end up somewhere, and if you're unlucky, this is going to be a predatory publisher. Besides that, people from low and middle income countries, if you want to publish in a reputable journal, there are some waivers there, so depending on where you're from and which journal you are at, but it's not across the board, so this is really a problem. And what I've heard too is from researchers from low and middle income countries that there is potentially bias in editorial boards, who is an editor, and then research from low and middle income countries might not get the same chance depending on who looks at it and who's a peer reviewer, who decides on that. So these are all factors. Besides that, low and middle income countries, there's less funding for research, and then the quality of your project obviously is going to reflect that potentially. If you have less money to do really research, or less resources, fewer collaborators, you will have a smaller project in a way, and you might struggle to publish it somewhere else. So all of these somehow predisposing factors to go down the wrong path. Besides that, there's sometimes people who just want to get their stuff out quickly. If you publish with us, we try to be speedy, but obviously we've got editorial assessment, we do peer review, it goes for revision, it goes to the peer reviewers again. And if you just do away with peer review and all the revisions, You potentially can have your article accepted in 2 weeks' time, and then it goes straight online. There's no copy editing, nothing. And there you are. Some people find this attractive too, the really fast turnaround and guaranteed publication in a way.
If we can go to a point that was research coming out of poor countries, what happens is that people want to do research. They want to treat their patients and they want to do research. And they lack support. They lack a system around them that can help them do good methodology, do good methods, and they lack the money to do research. So yeah, by the end, because I want so much to do research, I end up with describing a case series of 32 patients. And also I won't publish it. Even in CMI, we won't publish it. So by the end, it will end up in a predatory journal. So again, it's one of these basic problems that we should discuss when we are discussing predatory journals, because again, this is a symptom. So if we really want to address problems, that's one of the problems that should be addressed.
Going back to Leonard for a second, you've been an editor for many years and a researcher, so you've also supervised young researchers. What is your approach to protection of these vulnerable young colleagues to this system?
For me, it's easy, Mark, but it's one of the points that should be, because I'm asking them, please let's look at it together. Let's think, what journal are you interested in publishing, and let's look at it together. So looking at it together would mean, if you just got an email soliciting an article from you and saying, especially if it starts greetings of the day, then probably a predatory journal. We don't want to publish with this journal. Although now and then you'll get an invitation even from Lancet Infectious Diseases asking for a commentary, right? But most of these soliciting emails will be from predatory journals. And then the second advice is, think about journals that you enjoy reading. Think about journals that you read an article from them in the last half a year or in a year. Probably they won't be predatory journals. Probably they are in your own domain. You know about them. You've enjoyed the articles you looked. So think about them. Maybe you can send your article to them. Look at the site of the journal. There are quite a few pointers on how to recognize websites of predatory journals. So look at the website, because they look different from websites of the journals that you know are legit. One curious thing is that, do you know this thing about the impact factor with a star? Have you ever seen that? Okay.
No.
Some journals, ours as well, have the impact factor on their website, right? And then you see a journal with impact factor 4, and there's a small star. And the star means we have calculated it by ourselves, which is still an impact factor, but it's not a Clarivate impact factor. We have calculated the impact factor by ourselves. So if you see that, you won't see it too often, but you do see that. So that's another advice. If you see a star, don't send your article there. There are lists of predatory journals, and there are lists of open access journals that are legit. And you can look at this list. They're not that good, all of them. And although we think that the Clarivate impact factor, we know problems that we have with Clarivate impact factor, it's not such a bad thing to look if the journal is listed with the Clarivate Web of Science. And I know there are some problems with the journal listed in the Web of Science and problems with journals that were listed with Scopus. There were some problems and journals were taken out.
Leonard, I have to interject there, because if people go to Clarivate, to Scopus, they will not find CMI Communications, the new open access journal that is the official journal of ESCMID. I just want people to understand that new journals, they take a couple of years to get in.
Yes, you have to prove yourself. That there are very strict criteria that you get indexed. Yes. So they look at what you publish, how you publish, your standards and so on to be indexed there. So for the new journals, you have to wait a little bit, yes.
Yeah.
You mentioned some very, let's say, remarkable points. So if the email starts with greetings of the day, you're there. Stay with the journals that you read, the way you get your information on, because those will probably not be predatory journals. And if you publish as a young researcher there, you have the highest likelihood that your relevant peers will see what you have done. Now, I have a question to the three of you. You're all three editors. How many times per day are you thinking of the impact factor of your own journal? and how to raise it? Or is that none of your thoughts anymore? Please be honest.
I really don't think about the impact factor. I don't know, it goes up, it goes down. But then I've been doing it for years, so probably I care less. The publishers, for sure, do care about metrics and stuff, and then they send it around when it comes out, and it's a big deal. But for me, when I make decisions, I really don't think about impact factors. I think about who's reading my journal, what's the state of knowledge, and then does the article I'm looking at fit into that? Sometimes I publish stuff and I do think about the impact factor and think this is for sure going to drag us down, but I still want to publish it because it's important.
Lancet Infectious Diseases is up there. Ursula really doesn't have to think about the impact factor. For us, what happened is that when there were changes in the impact factor in the ranking, the last change in the ranking was this year in the ranking of CMI. We have seen immediately within 1 or 2 months a change in the submissions. People are looking at a list of impact factor. And we've seen much more submissions that we expected. And I must admit, better submissions that we had a year ago. I'm trying to tell my colleagues that think about journals that you like, because there are journals with maybe not that high impact factor, but the review process is very nice. The editors are helpful. So think about journals where you had a good impression of what happened there during the review process.
Leonard, you're saying that you can tell clearly that impact factor matters to your authors, to your potential authors, but you haven't really answered Marc's question. How often are you thinking about impact factor when you are evaluating a new manuscript?
I don't think that ever. But there are other things that we'll discuss later.
Marc, from my side, I think it's nice to have us three editors-in-chief on this call, because we're really all three from very different categories in a way, right? Ours is a baby journal. We're just starting out. We don't even have an impact factor yet. So the one thing, though, that we have in common, of course, with CMI is that CMI Comms and CMI, we are society journals. And I think for me to answer your question, it's quite easy because I feel incredibly supported by ESCMID. We know we have a society behind us that is not for profit. It's non-profit. It cares about education. It cares about moving the discussion further, moving knowledge further. So I get to rest on that. I also just have so much to learn. I was an editor at CMI for 7 years, but this is my first time being an editor-in-chief. It's a whole new ballgame. I don't entirely know what to expect with our first impact factor, so I just don't even think about it. I think I have a very potentially naive outlook. That outlook is that, look, if we're publishing good stuff that's original and that's useful, the impact factor should follow. Maybe it won't follow right away. Maybe it'll take some time. But we're very lucky because in that in-between space, we have this great support from ESCMID. So lucky to be society journals. Ursula, I think you're not a society journal, but Lancet is a society in a way, right? You have also, I imagine, incredible support from the bigger Lancet.
Yes, I think we were quite privileged in the position we are in. And then for us, no one is telling me, oh, you need to achieve a certain impact factor. Don't publish this because it's not going to be good enough. You have to publish more of that to get a better impact factor. I don't know. We've been around for a long time. We're well established. We really work for the community of authors and readers and peer reviewers. And then for us, as an infectious disease journal, compared to some others of the disciplines, we have a lot of small topics in a way, the neglected tropical diseases, which we do a lot of. And then we actually do publish quite a lot of low and middle income country research. We have a nice niche that we have. That might be one of the advantages of being with this bigger group and then having the for-profit publisher behind us, that it supports us to do this stuff. So if it was just us and we needed to make a lot of money, maybe our strategy would have to look different. We publish stuff that's never going to make money, which is nice that we can do that.
So we have seen, especially in the area of infectious diseases and microbiology over the last few years, also because of the pandemic, that these impact factors have exploded.
Yeah, they're crazy, go up and down. Yeah.
They have gone through the roof. Now, that means that papers have been cited much more because the impact factor is the result of citations. What's the role of these predator journals in this process? Are they encountered in calculations of impact factors of the regular journals, or are they not?
No, if they're not indexed, then they're not. It depends whether stuff is indexed or not. And then, as we already said, for indexing, there's some rules. Sometimes journals are delisted for unethical behaviors, but then there's still some left because it takes quite a lot of time to investigate journals and to come by a proof of how journals behave. And then there's also so many of them. I don't know, there are thousands and thousands of journals. So it's quite difficult to keep on top of that. So I do understand that the indexes don't have an easy job either. So it's not necessarily a guarantee that everything is all right, but across the board, somehow it should be okay. But if you just Google papers and look on Google Scholar, there for sure that stuff is counted. That may be a word of warning for inexperienced researchers. Google Scholar is not a scholarly index. It's a search engine and just grabs whatever. There, everything is counted. And then sometimes people even buy citations in a way. So that's another business model that those predatory units have. So you can say, I want citations for my paper on Google Scholar so that my H index goes up. And then you can get 20, 30 preprints posted that cite your article. Those all go on Google Scholar. Preprints get deleted afterwards, but your H index is still up there. All kind of unethical behavior.
And this is the citation cartel that you were mentioning earlier?
Yes, that's one version of it. Besides that, there are also others where you manipulate the peer review. Sometimes you get peer reviewers who say, oh, cite all these 10 papers and it's all their own. Which
we've all had that. Yeah.
Yes, so we see that. But then on a bigger scale, this happens in citation cartels. You suggest, for example, peer reviewers and they all say cite this, or sometimes journals between themselves. So if you look at groups of journals and look at the data and suddenly there's a big increase of citations to journals of the same publisher, and then they all get a boost of their impact factor because of that.
People are very creative. So last week I heard the story of scientists that submit a paper and then recommend reviewers.
Yes.
And then they've changed the email address of that reviewer very slightly.
Yeah, just one letter or something.
And they get invited because they own that email address, and then they make their own review. What about that?
The authors review their own articles. Oh, dear. Well, we need to look out for that, too. Something else to put on the list.
Yeah, you have to be very careful with such peer reviewers. Yes.
So actually, this is a little...
This patient is getting sicker by the hour.
This is a total aside, but you're making me think of something, Marc. So pretty much all journals ask authors to suggest peer reviewers for their own article, and they give them the opportunity to block other potential peer reviewers that they don't want, that might be in competition with them or might have some reason not to give them a favorable review. Leonard, you, I think, once told me that there was maybe some evidence that someone I suggest to review my paper because I think they're going to like me and my work, those people actually sometimes are more negative.
No, I've seen a study done by the BMJ comparing the reviews of reviewers that were recommended by the authors to reviewers that are just solicited by the editor. There wasn't much of a difference between what they were advising. No, they were more strict, but their advice was the same quality and their advice was the same. Let's hear what Ursula thinks about that.
We don't ask people to suggest peer reviewers. Sometimes people do it in their cover letter, and then it doesn't really factor too much into who we choose in the end to peer review. What we do take into account is if people say they want to exclude someone, but if they've got a list of 20 people, then obviously you can't. But if they've got one person and say there is a clear conflict of interest, then yes, we'll take that into account. But I would say, as Leonard, there's probably not much of a difference whether someone has been suggested or not. And the same on the other side. So sometimes there are quite critical peer review reports, rather harsh. And then people say, oh, I know exactly who this was. It must have been my competitor. And it never is. So I've never had anyone guess who a peer reviewer was. So.
Well, that's heartening. That's good to know. So next question, Ursula, getting back to our prey, so the victims of predators in publishing, what are some resources for them? We know now from Leonard the red flags. Are there resources online for potential victims of this kind of predation? Are there counter efforts going on?
Leonard already mentioned some of the things that are out there. For example, there's some checklists. So one that's quite popular is Think, Check, Submit. That has some of those red flags that you can look out for. So you can go through it and then see, is there anything with this kind of publisher, this journal that I should be careful about? Then there's the directory of open access journals. As we already said, those directories and then indices aren't perfect, but it should be some guidance. Then you can always ask someone more experienced. You can even go and ask librarians. Librarians at universities, they're very interested in these topics too, and they often have quite good knowledge and resources as well to help you there.
Wasn't it an academic librarian who came up with the term
yes,
predatory
Bill, he coined the term predatory journals, predatory publishers, and then he had one of the first kind of blacklists. There was some criticism out there because some of the criteria, I'm not sure whether those he specifically used, the spelling mistakes, stuff like this. But then if you look at publishers that don't have the same resources, that might not have English language as the first language, then this stuff can happen even if you're an ethical publisher. So it's always a bit tricky. But yeah, he had this list, but he discontinued it because he got so much grief. He was sued. And obviously there's a interest of publishers not to get onto the list, and they do quite a lot to antagonize any kind of concerted movement. Besides that, since we were speaking about resources, there's information campaigns that somehow reputable publishers do, webinars, stuff like this. So you can check that. As we were talking, it's a structural issue in a way where all the stakeholders somehow are involved. So it shouldn't only fall to the authors to avoid the predatory publishers. We were talking about the incentives, the business models and so on, the universities, and that needs bigger structural change, I think. And those people need support. So I do see a role for traditional publishers and the universities to provide more support there. As I said, we do offer waivers for stuff. So my journal is mixed. We've got subscriptions still, and we do have open access. For the open access papers, we do offer waivers if you really come from a low income country and then can't pay. And then diversity of your peer reviewer pool so that you have fair assessment. Diversity ideally of the editors as well. So all of us obviously sitting here, we are not from a low and middle income country, and that is an issue to address, I think.
All very important points. I think it's worth mentioning here for any early career, mid-career author, any author really from anywhere in the world, just ask for a waiver for the open access fee. You may be denied it, but you should always ask because, most of our journals get some amount of waivers. So always ask. It doesn't hurt to ask.
That's a good tip. Thank you.
Countries and universities also have deals. So they provide funding based on the number of articles they publish. And then the deal in a way covers your fee that you would need to pay. So it's worthwhile to check whether there's anything around for your university. Let's say for Switzerland, the Swiss universities have a deal with us. So they need to publish open access, but they don't pay a fee because this is covered under the deal.
Yeah. So to all authors out there, spend some time online looking at what is offered to you already by your institution, by your country, by your region. So our 3 journals are all published by Elsevier. And following on your comments, Ursula, on what the Swiss universities are doing, Elsevier also has a program for authors from lower middle income countries. It's where basically if you're from a lower middle income country, and there are a lot of countries on their list, you get a waiver of the open access publication fee. Research for Life. I was trying to plug it for authors. Thank you.
One more question that's related to publishing and for young investigators. How do you as editors handle papers that have already been put on a preprint server? Does that influence your decision making?
Maybe I can answer for us. It's totally fine to preprint stuff, and it doesn't really influence any decision. It doesn't matter to me whether you've preprinted or not. The assessment is going to be exactly the same. So for some topics, I think it's really good if people preprint. If it's urgent results and then you want to get them out there, then you might as well preprint it. I don't have anything against that. But then besides how it influences the later publishing, I think that there are some issues with preprints. If just anything can get preprinted, you do need some quality control there too. Because as we saw during COVID, things get preprinted and they turn out to be wrong and they've already been reported by the media and somehow it's a story already. Papers are handled the same by journalists, whether they're preprints or not.
Yeah, I would say also from my side, the preprint doesn't really matter to me, but I am a little bit on social media for the journal. And I have to say there's one thing that kind of worries me, and that's when authors put their stuff on a preprint server and then they massively promote it. And this is before peer review, this is before any publishing, and they don't note that they're clearly marking that it's at a preprint server. But not everybody understands that these articles have not been peer reviewed or really vetted in any way. That worries me, and I think it puts everybody in a difficult situation going forward from there. I wouldn't want authors to feel that they can't promote their own work. That's fine, but please always do it in such a way that you're making it very clear that this is a pre-peer review product, that it is still very preliminary.
Yes, I agree. For some journals, it won't matter too much. They don't change much during a peer review. But other articles, I don't know, the version that was pre-printed and that is initially submitted to us looks very different from what's in the end published. And so I think it does need a disclaimer if it's only a preprint. And obviously peer review is not perfect. Not everything is picked up, but that doesn't mean that we still don't have to exercise some caution there.
I think if I may ask a follow-up question. So Leonard, you said universities are very much driving this problem and they need to fix themselves, basically. And Marc, you mentioned that the dean of your university has put into place some measures that are alleviating to some extent this problem of universities just wanting numbers of articles published in order to drive people's careers. Can you elaborate on what has been done and what can be done?
Yeah, so the movement is called Science in Transition. It has several aspects, and one clear aspect is not to focus anymore on the impact factor of a candidate for promotion, but more on what the person has done. So the list of 5 publications that the person considers the most impactful work that has been done. That's a standard criterion now. So I never review a list of 200 publications anymore. It's the 5 that are put forward by the candidate. The other thing is that we have defined clear career paths. So you can have a career path in education, in clinical research, in exploratory research, in valorization. And the criteria for each of these are in general the same. You must demonstrate capability to make scientific impact, to be innovative, to be capable of collaboration nationally, internationally, locally, to be qualified for education. So have your education qualification. That's a prerequisite for any promotion. And that has really changed that process over the last 5 to 10 years. And it's called Science in Transition. And I think more universities are joining that movement now. It also got a nice illustration in Nature some time ago. It's already a few years ago. So that's what happened at our place in Utrecht. And I'm very happy with that. Times will change. The young generation will see how others do this and they will change this, but it will take time.
Yeah, obviously it's easier to somehow have numbers. You look at numbers of publications, impact factors that you've published in, and then you do your review of the dossier, and then you just look at the numbers, and otherwise you do need actual expertise in assessing the papers.
As we come to a close, Ursula and Leonard, what are the key messages you would like to leave our listeners with?
Don't send your work to predatory journals, and ask your colleagues, ask your more experienced colleagues how not to do that.
Yeah, I agree with Leonard there. Think before you submit, and then you can ask your colleagues. You can also get in touch with journals and editors. So a good journal should have some contact details. You should see their policies on the website, and then how you're supposed to submit and so on. You should see what's published, and then you should be able to reach them. And then there should be real people sitting behind the journal. On a bigger note, since we're in times of AI, I would like to stress the value of editors, whether they're professional or academic, and then the judgment and the expertise. This has real value and it's important. It saddens me that it gets lost sometimes in this flood of articles and then all this business and money making. So I would like to hold up the flame there for quality and good science being done and advancing the field.
On that perfect note, I will say thank you. Thank you so much to our guests, Ursula Hofer in London, UK, and Leonard Leibovici in Tel Aviv, Israel. And thank you for listening to Communicable, the CMI Communications podcast. This episode was hosted by Marc Bonten and Angela Huttner, editors at CMI Comms, Estimed's open access journal. It was edited by Dr. Katie Hostettler and peer-reviewed by Dr. Özlem Türkmen Recen, Izmir Public Health Laboratory, Izmir, Türkiye. The music was composed and conducted by Joseph McDade. This episode will be citable with a written summary referenced by a DOI in the next 8 weeks, and any literature we've discussed today can be found in the show notes. You can subscribe to Communicable on Spotify, Apple, wherever you get your podcasts, or you can find it on Estimed's website. Thanks for listening and helping CMI Comms and Esmed move the conversation in ID and clinical microbiology further along.